There's a big vein that runs right there. I don't know if you can see a little bluish tinge there. It's really, really hard to see, but it's always right where I want to put the filler. And so when I do this area, I almost tell people, oh, they're always going to bruise. They don't always, but if they are, it's going to be here. It's going to look like they got punched. It ends up looking like a little nickel, a blue nickel. But with Linda, I can see where her vein is, so we're going to try to avoid it and just do a bolus and spread it out. And you can usually tell where you need it by pinching. You can see where the volume loss is, or where sometimes the ligaments will pull in. And what we want to do is get rid of that little depression there. I hardly ever use a 1/2-inch needle, but the boluses, it's the only time I really use them, unless I'm in the just perioral lines or the glabella. I just would rather have less punctures overall if I can help it. Just kind of pinch the skin up, and then I'm going to just put a little bolus against the bone. And then mold it. And you always want to make sure, too, you're looking at it from below, because someone shorter than Linda, if they look up, you want it to look smooth. You want their jawline to look smooth from the top and from the bottom. You want to have a gap in that bottom. Put a little bit more in. And it can take more than you expect in this area. Sometimes I'll do a 1/2 syringe on each side. Even a syringe sometimes if someone's pretty deep. I just don't want to give them that Jay Leno look. So rather than fill this up too much, which can happen if someone's really deep here, if you fill this up too much, they're going to have this chin that just is so big and square. So for that, I tend to try to pull as much back as I can by putting filler back here, and maybe undercorrecting this part, just so they're not their chin isn't out of proportion to the rest of their face. And sometimes too, they just need surgery if they have enough loose skin there on their jawline. And I want it to feel smooth, not so much it does look better if I can get it looking smooth from the outside, but patients think there's something wrong if they feel a big bump. They feel that's abnormal. And actually, I'm putting in a fair amount to lift it out, so you are going to just feel one little area for a few days that feels kind of rubbery. But the reason it is just in that one area is because that's the only area I had to lift out. I'm just going to put a little bit in to just correct it just a little bit more laterally. And even when I'm pinching, I can kind of direct where it's going. And start again with a 28 gauge. And I kind of put a little counter traction on. I'm subdermal. I'm going to fan. I want to accent the jawline, and I want to pull back along pull back some of the skin down towards the chin, back up towards the ear. And I'm just trying to tend the skin forward here just so I can get into it. I'll go down a little bit. Just kind of mold it. Is that okay? Mm-hmm. Okay. This is a nice area to do on most people that don't have real broad jaws. Because without even really thinking about it, sometimes just having a little accent to your jaw, your mandibular angle there, is a nice balance for the rest of your face. But especially to help it pull back and get rid of an area where it looks loose. And what I'm going to do is go down to where it starts to puff out a little bit there. I'm going to use a little longer needle and just bend it so that I don't have to bend my arm so much to get it to go in parallel to the surface of the skin. Let's see if I can find my other puncture site. So here you can kind of see where the end of the needle is right here, which is right above the little poochy area. And instead of really making it look bigger, what we do is we fill above it and go up towards the ear to pull it all back. Make sure it feels smooth and that it's even. And then I'm going to just put a little bit going up this way too to kind of help pull up right in front of the ear.